during COVID, every institution has to go online. And it took only half day for us because we were already online. We were already adopted a lot of technology in our college. There was huge shortage of nurses in Australia. So I decided to set up a college. That's why IHNA is established in 2007.
My passion for nursing is really linked to the idea that we're in this together. We are in this together, whether it's life or healthcare or having a good time.
Initially, it was almost like not possible because they're so big institutions. What IHNA or HCA can do with them. But I'm always ambitious.
There's a lot of negativity around nursing at the moment in the media. There's a lot of we're really short-staffed, everyone's really overworked, nurses are underpaid, they deserve more money. The world needed nurses. And I think that we have to keep reminding them that's not changed. The pandemic may have changed, but we still need nurses.
Good afternoon, everybody, and welcome. My name is Helena, and I'll be trying to chair this lovely fireside chat with three lovely executives so that we can get a better understanding of innovating nursing education for the future and bridging academia, industry's practice and global healthcare needs. So this afternoon we've got three wonderful panel members, and I noticed that Bernadette and I got the memo about the colours to wear, which is fantastic. So clearly pink is the colour, Bernadette. So I'd like to introduce to you our panel today. Obviously, Dr. Bijo, he is the CEO and Managing Director of Healthcare International. We all know him as a very visionary leader in terms of healthcare, education and management. Under his leadership, he's provided quality training and commitment to student success. Dr. Bijo also has recently become a Dr. Bijo, which is fantastic. And he's gained valuable research and insights in his research, and he continues to provide paving the way for advancements in healthcare education and inspiring future innovations and research in healthcare for healthcare professionals. Please welcome Dr. Bijo. Also beside me is Professor Judy Karshmer. She didn't get the memo. Sorry. But wearing Melbourne black, which is fabulous. So Judy is a Dean and Professor of Arizona State University, Edson College of Nursing and Health Innovation. She came to ASU in 2018 from the School of Nursing and Health Professions in San Francisco. At ASU, Judy has also been instrumental in developing the first doctorate of nursing program in California and establishing an evidence-based education model challenging students and faculty to think creatively to produce better health solutions and outcomes. She's graduated in her bachelor's degree in 1997. I want to go back. She's a fellow of the American Academy of Nursing and was named the most influential woman in business in the Bay Area for Forever Influential Honour Roll in 2016, and she's on the editorial board of the Journal of Psychosocial Nursing and Mental Health Services. She did graduate with a Bachelor in Nursing in 1970, and she's had lots of other qualifications too. Welcome, Judith Karshmer. I'd like to welcome Associate Professor Bernadette Eather. She's Chief Nurse and Clinical Director at Ramsay Health Care Australia. In her role at Ramsay Health Care Clinical Governance, she has patient safety and clinical quality programs, including facilitation and accreditation of those programs. As the Chief Nurse at Ramsay Health, she leads the Ramsay Health Nursing and Midwifery Academy, and they continue to work on the development of comprehensive nursing and midwifery career pathways and programs. Prior to her role at Ramsay Health, she was State Director of Patient Safety for New South Wales Health. She also holds a Master's in Health Management and has recently completed a Master's in Law. I think I said this last time because you had nothing else to do.
We were really quiet during COVID.
Bernadette's passionate about patient safety and is a doctor from the University of Technology, Sydney. Please welcome Associate Professor Bernadette Eather. Well, that's a lot of bio, isn't it? Thank you very much for being here today. Today we're asking you fireside questions that have been put to us by some of the employees. So we're going to start with all of you, actually. Could perhaps each of you share what inspired you to progress your journey into nursing and how you came to focus on nursing and education in the way that you have? So we'll start with Judy.
Well, thank you. I'm delighted to be here and looking forward to having this chat without the fire and the fireside. So I actually have been one of the people that we were sharing stories last night about how did I come to be a nurse, and it's been a calling since I was very young, only to realize that when I got to college to prepare as a nurse, I didn't know I really liked it because it wasn't exactly what I thought I was getting myself in for. I stuck out staying in college because I found that one of the glorious parts of being a nurse, it's not a one-size-fits-all profession. You can be a critical care nurse, you can be a emergency room nurse, you can be a school nurse, or you could be a psych nurse like I am. And for me, that was like coming home to a passion of being connected to people. So my passion for nursing is really linked to the idea that we're in this together. We are in this together, whether it's life or healthcare or having a good time. And one of the reasons that I'm so keen on this partnership, is that we're not in this alone, we're in this together. So for me, being a nurse is the manifestation of what it is that I try to do every day, which is connect to people.
Thanks, Judy. And Bernadette, what inspired you to look at healthcare and nursing?
I think, as Judy said, we were talking last night, and I laugh in some of my lectures. I've got a photo of me when I'm 4 years old in a nursing uniform, and I was the nurse in charge of the soft toy hospital at my kindergarten. So destined for management, but that's the only thing I ever wanted to do was nursing, and getting into that very passionate about it. But I think probably what's kept me in nursing and kept me passionate is just all of the opportunities. As Judy said, it's different clinical specialties, but, there's a huge body of work, nursing in research, in education, in management, whether that's running hospitals. We've got nurses who are we have 75 hospitals from Ramsay Health Care, and quite a few are being the chief executives and nurses. So you don't have to stay as a clinical nurse, but if you do, those pathways to advanced practice just make it fabulous. So I say, for students coming in, and for those of you, Jen said that you're meant to have 7 careers. Well, the lucky thing is you can have all 7 of those careers in nursing, which is really exciting.
It's fabulous. And Dr. Bijo, what inspired you to pursue your journey in health?
Okay. I am from Kerala, the place where almost every family got a nurse. So we have so many nursing professionals in Kerala, and many of them went to many parts of the world in terms of jobs and migration, and that's actually contributed to the economy of Kerala. So I came from that background, and in 2003 I got an opportunity to recruit 20 nurses to Austin Health in Melbourne. So that was my turning point in my life to going into nursing area, and until then I was always into engineering, working in the projects. So that changed my life, and I started Health Careers International from then, which was focusing on bringing internationally qualified nurses and doing a bridging program with Austin Health first of all, initially. Then we started with the many universities in Melbourne, and then that gave me an opportunity to understand what's the bridging program, how the courses is run. Then we work with hospitals to find jobs for them. So Health Careers is always focusing on outcome, jobs. So I find a gap in education space there, because universities was not very keen on these short courses, so 3 months course, which also need a 6 weeks placement. So it was difficult to find placement in that time as well. But there was huge shortage of nurses in Australia. So I decided to set up a college. That's why IHNA is established in 2007. Then we have a IHM in 2015. So the journey continued with the healthcare education.
Thank you. And not a lot's changed in relation to the demand, is
Yes.
So thank you. Question for Judith. ASU, Judy, is renowned for being a #1 university for innovation, particularly in the US. And for us, it's a brand that we're starting to get to know and understand. So its core value for Ramsay and HR and us is we've got common values in many ways. So I'm wondering if you could share some of the innovative ways that perhaps ASU is implementing or enhancing nursing education today, and perhaps share that with our audience.
Absolutely. Our president of our university likes to, we no longer say for the 9th year in a row, we say every year in a row, we've been named the most innovative university. It translates very nicely to our the value that we have at the university, which is we don't measure our success by who we admit, but who we graduate, who we include, rather who we exclude. And the idea being that there are lots of pathways to get to higher education if you give them. And that's our responsibility. So we talk about innovation to be innovative in how we bring students into the program, that students can be online, in person, hybrid, that's an important way so we can take education to where the people are. And then we talk about the innovation of how we educate students. We are able to deliver entire programs that are highly technical, like biochemistry, fully online. We learned very clearly that we could take a lot of nursing education to the learner through technology. And then, so part of the innovation is how we bring our students in and educate them. But I think core to what we are talking about in terms of innovation is that we start with students. We don't tell them this is the best way of doing something in healthcare. We ask them, what is your solution to the best ways of doing things in healthcare? So from the very first course our students take, we ask them to produce a solution to a problem. And these are freshmen. These are first-year students. They haven't been jaded by what the answer should be. They start with what the answer could be. So it's been a delight for us to be able to, in nursing education, say, I'm in an ethos that says you can try things out. Failing is not prohibited. It's in fact okay. And as we look at innovation and startup mentality, design thinking, it's all about making sure that we listen to our learners, try things out, and then evaluate what's good about them.
Thanks, Judy. Over to you, Bernadette. Ramsay Health Care, how do they prioritise this continuous education within Ramsay, and particularly in terms of the nurses and healthcare's professional development, ongoing professional development, so that they can keep high standards and maintain high patient care?
Yeah, no, I think a couple of things I always say up front is, particularly for students, you graduate, you think, yep, I've got my piece of paper, I've got my degree, I've got my certificate, that's it. It's like, no, that's just the beginning. Really, that nursing is lifelong learning. There's new technology, new treatments, new way of doing things. So that requirement for continuous education is always there. So we're really fortunate. In Ramsay, we've set up a Ramsay Nursing and Midwifery Academy, the team of which are all here, and you can speak to them later on, find out what we're doing. So we've set up an academy to provide a comprehensive career pathway for nursing. As I said, if you want to go into management, you want to go into advanced practice, you want to go into research, we're providing those opportunities. It's like a lot of areas in healthcare, nursing's becoming very subspecialised. And so being able to provide that technical training and support is really important. And we do that through simulation. We're looking forward to the partnership with HCI around what opportunities we have there through simulation training, on-the-job training. So we're not just committed because we believe in it, but it's an absolutely fundamental to be able to provide high-quality, safe and effective care for our patients, that our nurses are highly trained. We have more nurses than, we are the biggest profession in healthcare by far. And certainly in terms of Ramsay, we have 38,000 employees, 20,000 of whom are nurses. So we make up the biggest bulk, I argue, the most important, but I won't say that. And therefore that professional development education is just so important. It's fundamental to good patient care.
It's critical. Thank you, Bernadette. Bijo, so can you tell us and the audience about the strategies that Health Careers International has adopted to address the rapidly changing needs of the healthcare sector in nursing and education? We touched already on some of the technological changes.
Thank you. Our mission is education for employment, bridging the gap globally. So currently there is a global shortage of nurses. After the pandemic, I think after the COVID, there become even requirement for specialty nurses globally, especially mental health, critical care, emergency. So we are looking into promoting nursing education and working with industry partners in order to make sure that our courses are industry relevant and job ready. So this partnership, Ramsay Health Care, is the most important part of this equation. We definitely thinking that our mission will be fulfilled only through industry connection and commitment from Ramsay and other institutions we work with. Definitely going to give our students job opportunities or job ready, and they can start commence their work. But in order to prepare them to the changing world of technology, as a college, I think we claim we are one of the leading institution in technology adoption in Australia. So we put a lot of effort on that area. Even I think during COVID, every institution has to go online, and it took only half day for us because we were already online. We were already adopted a lot of technology in our college, well ahead of COVID. So for HCI, for our students and staff, it was quite easy for us to look after the students not able to come to the campuses. So we were prepared, and on top of that, I think we have a specific team working on continuously understanding the technological advancement in the workplace. So we adopt technologies, simple things like we have a chatbot which is called Rishi. It is available in our website, and then our mission is to make this chatbot be able to provide individualized support to students, because every student has specific needs, and especially when you look at international students, they have much more support requirement than domestic students. So we are trying to build on to our chatbot. It's already using for last 4 or 5 years now. But with the new advancement in AI, I believe that we could take advantage of that AI adoption to give more personalized support and education to students. This is what we are working on. And another area is basically connecting the campus to clinics. So we're developing a product called ClinSort that's specifically looking into whatever we're learning into the campus need to be connected to the practice they do in the workplace. So this product also in the development for last 3-4 years, and we implemented it into our nursing programs. And we got very good feedback from the industry as well as the nursing accreditation bodies about the usage and the students' involvement on it. And that's kind of things we do on a regular basis.
Fantastic.
So I'm hoping that we can continue to research and invest into. There's a lot of AI tools coming into nursing or nursing practices. So we will learn a lot from our partnership with Arizona State University. They are leader in innovation. So this partnership, I am also expecting that we can adopt a lot of already using technologies from the ASU part. So one of the things is ASU is the first university in the world signing up with OpenAI or ChatGPT to develop a customized product for university. So that's something which I think being a partner we could actually
exciting.
Learn or adopt in the future. That's what I'm expecting.
And very innovative, Judy.
Yeah. Our staff and students to access lot of resources, which I think the curriculum and content, which is one of the top quality in the world. And we are privileged to be able to work with ASU. Right. So these are all the strategies we put up today in order to take us to the next decade.
Thank you. Some fantastic projects there. Judy, so touching on some of these points and innovation in other areas, but how important is it that ASU balances academic excellence then with the development of practical skills and the clinical practice that's required for our practitioners when they get out there? So how important is that for ASU to balance both that and the innovations required?
Such a good question, and following up on what you were talking about in terms of preparing the nurse for practice, we'd like to talk about the fact that you cannot do this without high-quality partners, because we're not preparing the nurse for theoretical. We're preparing a nurse that you want to take care of you. And if you're a student, one of the things that you want to do is know that you're doing the right thing with the right reasons, with the right information, and that you have sort of a way to think through new ways of caring for your patients. So I think that we like to think at ASU, I always joke that nurses are excellent at workarounds. They have made workarounds part of their entire career. We now redefine that as innovation. And it is an important thing for you that are students that you are empowered when you're sitting there and you see something, you go, well, that doesn't make sense. We could do it better this way. So the one thing is to, first of all, empower your students. The second is to make sure that you're working with a partner that's willing to think about the ways to do things. And then third, I think that the technology resources, like, for instance, ChatGPT, or our relationship with Elsevier, which I know you at HCI also have a relationship with Elsevier. So the idea that you as a student can say, I didn't really understand what that professor was saying, let me ask a different way, is probably a gift I wish I had had. And think about how we're going to be able to translate that to help our patients understand what they need to know to take care of themselves. So I think it's coming together that it is the commitment to excellence, but it's even more important to say that you have the wherewithal, you student, you faculty, to get to where you need to be, and we'll give you the resources to get there. We don't want to, I always say, anybody can pick a winner. It takes work to make one.
That's true. We've got our Melbourne Cup coming, so that'd be good. We'll need that advice, Judy. So thank you. Bernadette, in terms of Ramsay, just focusing on Ramsay Health Care as an organisation, what do you see as the main challenges in preparing newly graduated nurses so that they can meet the demands that a healthcare organisation like yours requires?
Yeah, I think it's firstly, I said we're quite big, and having those, the 75 hospitals across the country, and they've all got different patient groups, they've all got different demands. So, is everybody going to be ready at the same time and graduate with the same level of skills? No, that's the reality that they're not. So what we make sure, firstly, is that at undergraduate that you get exposure and experience in clinical areas so that you have really strong clinical placement opportunities to get that experience at the bedside and start to develop those technical skills. We then have a comprehensive preceptorship program and a new graduate program so that when you graduate, whether as a diploma or a degree in nursing, that there's a wraparound, there's a support for you. There's education and training days. You get assigned a preceptor to look after you, and in that first year, we make sure that first rotation that you get a solid 6 months in a clinical area. And that way you get familiar with the task, understanding time management skills, understand how to comprehensively assess patients, all of those things. And we're really fortunate, Ramsay, and the team here's developed a great new graduate program. You have your foundation year 1, but we also have a development year 2. So if you want to start to subspecialise or have other clinical opportunities, or, as I said, we're quite big, you want to pop up to Cairns, it's a bit cold in Melbourne today, if you want to pop up to far north Queensland for a rotation somewhere else, then we provide those opportunities. I think the other thing that's really important for us is that we have a culture, and we call it Speak Up for Patient Safety. And to Judy's point around that if you see a better way of doing something, to speak up. We really try and create an environment and a culture where it's safe to either, I don't understand, can you please explain? Or I think somebody's making a mistake, or anything, that we provide a culture and an opportunity that people feel comfortable that they can speak up on their behalf, on their colleagues' behalf, or on behalf of the patient. And that's really important. People often be fearful of asking questions or speaking up if they see something. What if I'm wrong? And we'll say, but what if you're right? And so, we really welcome that, and we work very hard to try and create that culture where it's safe to speak up. Lots of exciting opportunity for graduates, but we know that some people need more help, some people need a little bit less, some people need extra days, extra assessment, and we provide all of that.
What you're saying is it can be individualised. I mean, not everyone's going to be treated exactly the same on graduation. They're going to be provided that mentorship for.
Yeah, exactly. We have the program, but we understand that it might take people a little bit longer to get to a certain level of competency, and you have your preceptor, somebody who's appointed to you to look after you and to assess you. That support structure's there.
So one of the things that's really important for all of us is that this demand for healthcare staff across the globe is just increasing. I wonder whether, if you could all three of you talk about this in relation to your own areas. Bijo as a business owner and the training institution, from Ramsay's point of view, from ASU, so you're providing a bit of a worldwide view for us. So what do you feel we need to do to address this demand in healthcare across the globe in your own areas, and what have you done perhaps to address some of the needs for increasing people to be attracted to this area of healthcare? You can think about the policy. Maybe there's some policy changes you've been able to make, or something from your level of education that you've been able to progress. So I might just start with Bijo. What have you done?
I think the global need for healthcare professionals, especially nurses, are very high today. It means, let's say, huge shortage of nurses globally. Every country needs nurses. So to me, also the mobility of nurses increased in the recent past. From one country to another country, and nursing is it's a passport for them to travel and work anywhere today, and that is going to be the case for years to come. Only way to address is basically develop or create more nurses. That governments need to have policy and also maybe investment in terms of adding more nursing institutions or nursing positions. So this is not only for Australia or developed countries. This is also for countries like India or many countries, including developing countries. Everywhere there is shortage.
Yeah.
So I think it's all about proper workforce planning and investing. So without the investment, I don't think it will happen. So we are actually come out of one pandemic. It doesn't mean that there is nothing going to happen in the future.
Yes.
So I believe the policymakers has to understand that. If you look at recent law coming into Australia today, there's an international education cap or student cap, and that is also applicable to nursing students. If you look around, more than 50% of students in most of the universities are international students studying nursing program. So by having a blanket cap, there won't be many nurses going to be trained or graduated in the coming future in Australia itself. So I can see there is a lot of policy implications on this future workforce readiness. So that's a challenge, and I leave there.
Yes, we've had lots of challenges here in Australia, Judas, with our Premier of the country going over to India and saying she was going to change the national plan. So that was very interesting because, again, there's some changes in, we've got state and federal governments and they don't all agree.
I will support Victorian Premier 100%.
So I think we might
all support the Victorian Premier.
Some changes on these quotas. But I'm wondering what your thought was about Ramsay's position on this need for healthcare and what perhaps you've done already as an organisation, or what do you see needs to be done, Bernadette?
I think a few things. I'm taking a step out of Ramsay and nursing, and I recently spoke at the Australian College of Nursing and gave an address, and I think there's a lot of negativity around nursing at the moment in the media. There's a lot of we're really short-staffed, everyone's really overworked, nurses are underpaid, they deserve more money, and I think if I'm sitting at school and thinking, what career do I want, and hearing this barrage in the media about negativity, I think we need to flip that and really start to tell the incredibly positive stories. Nursing year on year is the most trusted profession. The importance of nursing, certainly from the health delivery point of view, from the economy, is absolutely vital. And I think sharing those stories of what an incredible career nursing can bring you and what it is, and to stop the negative talk, because I think we're going to see less people wanting to join nursing, which we're starting to see a lower intake in university numbers, because we haven't talked it up as a career as much, particularly post-pandemic. And I think that's something culturally as nursing leaders we need to start changing that. From Ramsay's point of view, I think, I think a couple of things for us. This partnership's very important. How do you increase that, the opportunity for nurses to have experience, whether it's at a high school level work experience, having that exposure, reinstating those programs. We have a cadetship program. So our undergraduate student nurses having placement can be co-employed. And we say, why work at Baker's Delight or Woolies, with all due respect to Baker's Delight and Woolies? Come and work in a Ramsay hospital at the same time as an assistant in nursing. We've got some cadets who are student nurses and they might be doing administration roles in the emergency department out of hours. So really getting that exposure to life in the hospital, I think that's really important. And the other thing we're really focusing is on flexibility. Not everybody wants to come and work full-time. Right. Judy and I were saying, people don't want to work the hours we used to work, just do the overtime and do all of that. That work-life balance is so important. So as employers and health service providers, we have to provide that flexibility, different shift times, part-time, casual opportunities. So I think there's a huge change in the workforce and we have to adapt to that.
Thanks, Bernadette. And your view, Judy, on the world US version of the healthcare crisis?
Yeah, so I do, just to follow on from what Bernadette mentioned, I had the good fortune of meeting your colleagues last night and your colleague here at HCI, who are all nurses. And this is not an exaggeration. There was an instant connection because we brought that to ourselves. And in light of what you were just describing, the importance of celebrating us, celebrating what an amazing career I've been able to have, is something that I think is really important. And I do think that we need to really portray that this is a very rewarding opportunity, and we can do very, very different kinds of things. And I think that does have an impact worldwide in terms of who chooses to be a nurse and why they want to come into be nursing. And we all have days that things aren't perfect. We all have days that it's important for us to talk about, it's okay for it not to be perfect. But flexibility, opportunities for people to have many entry points into nursing. It's not just an 18-year-old or a 22-year-old or a 40-year-old. What are the multiple paths to come in? What kind of opportunities do you make clear that there is a seamless transition from one type of nursing to another type of nursing, the kind of career opportunities that you can get? Ramsay HCI Connection is a perfect example of that, because it's not about either or, it's the partnership. The fact that ASU can be part of that partnership is an extension of a nurse that can start at HCI, will do work at Ramsay, maybe come to Arizona State for a graduate degree, circle back and really have an operationalization of what we know is true, that healthcare is global, and the nurse needs to be prepared at a global level and has to understand today's issues and tomorrow's issues and not be thrown off. The other thing I just need to say, that during the pandemic, I think that what happened is that people stood up and noticed how important nurses were. I mean, everybody knows a nurse. Everybody knows. Everybody's got a nurse in their family. But the world needed nurses. And I think that we have to keep reminding them that's not changed. The pandemic may have changed, but we still need nurses. And we need nurses across all levels, in all locations. Just because one town, one facility maybe doesn't have openings today, that doesn't mean they're not going to need them tomorrow.
No. Well, you answered my other question. She's really great. So we're going to move on to Bijo. Bijo, can you tell me a little bit more about HCI's vision then in relation to the future of nursing and nursing education in Australia, and particularly how you're positioning the institution in relation to this area so that it's an institution of best practice?
Okay. The vision is always, people say it a big vision in order to grow. So I always have big vision. So in 2014, I decided to have a higher education institute. So I got a mentor, which is Professor Anthony Welch. So under his direction, I started working, and then we made our college, which is IHM today. And in 2018, I got Professor Chandana Havek, which I wanted a PhD, which was almost impossible for me. And he gave me support and motivation to push through that journey. And it was good that COVID time, we could continue. Yes. So we got some free time also. So this is all possible. The big dreams comes and then big visions comes. This all only can be possible with support of mentors or people who can drive you through that. So this year I got a new mentor, which is Douglas Becker. So he come to us last year and start talking about taking our college to be working with Sindhana Alliance partners and connecting us with Arizona State University and Ramsay. But initially it was almost like not possible because they are so big institutions. What IHN or HCA can do with them, they are so big. But I'm always ambitious, so I just hang on to it, and then finally we got the partnership realized. So these are all the strategies we implemented at various times in order to take this college to be the number one nursing institution in Australia. So now the mission is to take this to the number one, above any university in Australia. So that need a lot of careful planning and work.
Yes.
So we are confident that with all the challenges in the industry, HCA will be able to build the best nursing institution with the support of Arizona State University, adopting the curriculum and support from learning strategies and also research partnerships, and practically working with the Ramsay Health Care hospitals to bring our graduates to get the best experience or clinical experience or graduate outcome, which no other institution can offer today in Australia. So this is the way we put our foundation now. So this is just happened this year. We are all trying to understand each other, meeting up and understanding what's the needs of each institution. How do we collaborate together and build a whole dream of making the best institution, which we will be proud of at the end of the day. So that's a journey we're starting today. And I'm very confident we'll be there very soon. Thank you.
And you've touched really on, and we've touched on it tonight already, which is this collaboration piece, the importance of it, which you've all talked about. So I wonder is there anything else that you feel would be important there when we're collaborating with Ramsay Health and we're collaborating with ASU that you see as critical for students? And I know you've touched on it a little bit, both of you, but is there anything else there that you feel is important? Yeah.
Basically, every college in Australia have different problems.
Yes.
Our college in Australia, how the problem is we can't accommodate all the students who want to join us. I'm hearing calls from campuses to say that they have not sufficient place.
Wow.
And everybody is saying the industry is struggling and no students. And I'm saying we have more students than we can accommodate.
Yeah.
So that's the situation today in IHCA, only because we have always focused on quality education. Last 20 years, we only worked on something which we want to build, high quality education, and that actually reached to the students and student experience. If you look at NCVR data or QILT data, it all gives the highest student satisfaction rate for IHN and IHM today. And that's already reflected in our teaching methodologies, our facilities, our campuses, our staff who look after the students. Our value caring is fully implemented into the campuses. So these are all giving us opportunity to get more students coming to us and asking for studying with us. But I think the students are the winner of this whole partnership.
Yes.
Everything what we're doing is we already built a foundation of quality education. How can we scale it and how can we reach to more students by not necessarily onto the campus? It could be flexible delivery, hybrid delivery, Australian International Education Strategy, the Australian government strategy calls for hybrid delivery to global education.
Yes.
Not necessarily everybody has to come and study in Australia. They can study in their own country and come and do practicals in Australia. And there is also online delivery of T&E delivery using offshore campuses, which we also implemented in 2022 in Kochi. We have a small campus in Kochi. It's a small beginning, it's a piloting. But with the Victorian Premier's commitment, I'm going to take it to the big level. So we may be the first Australian skills training institute in India, private sector, not university, to establish our base there. So I believe we have a lot of opportunity here in our hand, and our students going to be benefited by our partnership. The most important benefit to the students is streamlined pathway. Yes. Whatever they study in IHM, they can go into IHM to get a degree. From there, they may do the masters in USA in Arizona State University. So we are trying to integrate our curriculum from now. Whatever students do here, they have always the option to continue to study in USA. Either it could be on campus or it could be online. So Professor Judy and our team is today morning was working on some of the mapping of our graduate certificate in advanced nursing course to ASU's Master of Nursing program. Right. So the students have a choice to continue to study with IHM's masters or study an American university masters. So I believe, I'm very excited that this kind of opportunity was not there in the past. Without this partnership, I don't think it will happen also. Thank you.
Well, my last question to each of you is, and you've touched on it already, Bijo, where you're really advising students for today, but I'm wondering whether, perhaps from your perspectives, what advice do you have for our students today, or prospective students, around this industry, around healthcare, around joining even our association? But what advice would you have for current students, perhaps, Bernadette?
I think be curious, to ask questions, take opportunities when they come. As I said, you meant to have 7 careers, have them all in nursing. What else is there? That nursing is absolutely a journey of lifelong learning, so taking those opportunities. But I'll say just, be curious. I pick up on Judy's point about we're very tribal in nursing, and you'll find your place. Whoever it might be. Mine was intensive care. I went in and said, "Oh, these are my people. This is where I'm home." But even within that, there's still professional development. There are still opportunities to go. So I think just to embrace all of those opportunities as they present themselves.
Okay, lovely. And Judy?
So the students out there, good choice. That's my best advice. You've started on a pathway that is so wide open. You are going to have, what Bernadette said, the chances for you to grow and have a nursing career 15 years from now that looks very different than the one 7 years from now. And the fact that you're at a program that does value the transition from student to opportunity to workplace to opportunity to program, that's the kind of school you want to be in. That's the program you want to be in, that doesn't have stops, that doesn't have finishes, but has transitions. This is a never-ending growth, and you don't want to ever stop learning. But you have already, I always say the best predictor of success in any program is starting, and you've already done that. So congratulations. Best of luck, because I know that you have a career that's going to be unbelievable, and I can't wait to see how you contribute to us.
On that note, I want to thank our panellists, Dr. Bijo, Associate Professor Bernadette, and Professor Judy. So thank you so much. It's been a fabulous discussion, fireside chat. I'd like to add as a career practitioner that the statistics on the healthcare industry just continue. The demands are high. It's a sector that is very much around future. So when we look at careers, we look at how do I progress my career from where I am now, which you were talking about, from a graduate to, when I'm perhaps married, or when I want to work part-time, or when I want to retire. So future readiness, this industry allows for it. It allows for the future. Whatever your future is, you can progress your career because nursing adapts to that. And I think it's a great place to start. So I will encourage you. Thank you for all the time today. Thank you for the fireside. We didn't have the fire, but thank you for the chat. And thank you very much.
It is warm.
Thank our audience. Thank you. Thank our... Good one up there. Thank you. Oh, would you thank our audience?
Yes.
Thank you very much. I'm wondering, while we're waiting, is there any questions for the panel from the audience? Is there anything you'd like to ask Judy or Bernadette or Bijo? It's your opportunity. Anyone got anything they'd like to ask? Off you go. Nothing? Yes.
Thank you, everyone. That was really great talk, really interesting. I've got a question probably for each of you. I'm into down to it as practice-based evidence and learning from the front line and integrating things. What's been your favourite adaptation into each of your practices that came from the students or the patients, or what group that actually affected and became a new practice in your role? What's been your favourite thing?
Some favourite area that you practiced in?
So I've worked in patient safety for a long time, and we have, it's probably the approach in implementing new things is, I always say we've got the project, we do the project plan, we get it all developed, and then we implement it, and then, wait and see what the outcome is. But a big advocate of plan, do, study, act. So these very small cycles and just start small. And I was sort of, I wanted the big bang approach, and I had worked on a water unit, changing it as a vascular unit, and sort of, changing the way we're managing vascular access, and kind of we're coming up with this huge plan. And one of the students said, well, I learned the PDSA, so why don't we just try it with 2 or 3 patients and then see if that works, and if it doesn't, then we can change it. And I'm like, yes, that's what we're meant to be doing. So it was much more that approach with, coming in my management hat thinking we just had to change the world all at once, but just that chance, come in, make a few changes. If they work, great. If they don't, then, think about something else. So I love that small cycles of improvement approach, and really encourage people to do it. Try it a few times. Try the form. Don't print the 4,000 of them like I would do and say, this is the new form. Let's print 3. Try it with 3 patients. That didn't work. Let's change this. So I think it's much more that approach for rapid cycle assessment. It's good.
Did you want to?
Sure. So as I mentioned, I'm psychiatric mental health nursing's been my background, which is the best preparation you could have to be a dean. So, because I often see, I identify that I have a lot of walking wounded who end up in my office, whether it's students, faculty, staff, or parents. But I remember a very vivid experience early on in my career. I was teaching a class, and it was a class for nurses earning their baccalaureate degree, sort of from the diploma to the baccalaureate degree. And they were all working nurses. And we had a rule at my university that the change project, the implementation of change, they couldn't do where they were working because it would cause world confusion. And I said that out loud, and I didn't believe it. I said, why am I saying that? It's because that's how I'd been taught. And in fact, I said to the students, could you do this on your units? If I did it on my unit, I could make a change. So literally, in that moment, I said, you have to do it on your unit. Changed every one of their projects, and every one of them was able to at least get a small test of change implemented. And it was a perfect example of listening to your students as opposed to listening to people who told you what to do and they didn't know what they were doing.
Thanks, Judy. Any other questions before we finish up? I'd like to thank our panel again. Well done. Thank you for being by the fire, and hopefully we've encouraged and inspired other students to take up healthcare and current students to remain and continue their professional development. Thank you. Thanks, everybody.